Welcome to WNIN Newsmakers. I'm April Nading. To talk about a new center for assisting those with autism in Evansville, we have Erica Outlaw, the Executive Vice President of Clinical Operations for UNIFI Autism Care. Erica, thank you for being here.
Thank you for having me.
So tell me a little bit about, I guess just we should start with, what is autism?
Yeah, autism is a neurodevelopmental condition. Oftentimes we see symptoms happen in early childhood. It's actually a requirement of the diagnosis, and so symptoms have to be present early on. The other two main symptoms of autism are deficits in social communication and social interaction, and then what we call restricted or repetitive patterns of behavior. And so sometimes we see children who maybe they hand flap or they rock or they clap. So that's that repetitive or stereotypical behavior. Sometimes you might hear them hum or repeat words or say phrases over and over again. So those are the two main conditions.
But those could be all on different levels, right? I mean, just because they have one of those symptoms doesn't necessarily mean it's, is there a thing called full-blown autism, I guess?
Yeah, within the diagnosis, there are different levels. And so there's a level 1, 2, and level 3. And so basically, that just means which level of support that is needed for that individual. And so autism spectrum disorder is the actual diagnosis, and it's just that. It's a very broad spectrum. And so most of the time, you can't tell that an individual has autism, although autism is a very medical complex condition to where oftentimes there are co-occurring disorders that happen with autism. So we oftentimes see a lot of ADHD or OCD type tendencies that is also paired with autism.
So it's not just the one thing that...
It affects a whole child. It affects the whole condition, which is why UNIFI specifically is really focused on that whole child health, to where we look beyond just the autism-related symptoms, and we look at the child's whole functioning. How are they functioning in their life?
So do we know what causes autism?
Not exactly. Research is getting a lot closer. We know that it's both environmental and genetic predispositions or conditions that can affect autism. There have been also some other links to some other genetic chromosomal conditions, and so they're still doing a lot of research to determine what that is.
And then I guess then you have to ask, is there actually a treatment, or is it more of a behavioral changes with
there's no cure. There's no cure for autism, right? It is behavioral treatment or behavioral therapy. That is the gold standard, or what we call applied behavior analysis, which is what we do at UNIFI.
So, I mean, are they, I know they've talked like they want to try and find a cure or the exact cause or whatever by August. I mean, is that something you see on the horizon?
That's not anything that we have been accustomed to hearing or something that's been in the research, and so it'll be interesting to see what comes from that.
But how long have we known about autism?
So actually, the earliest appearances are like 1700s, 1600s, describing symptoms of autism. So the actual condition has been around for a very, very, very long time, or has been documented since then. Our field of applied behavior analysis has really been well known since the 1970s. Although our certification board, or the BACB, has only been around for about 25 years. So our science is pretty new as far as the treatment or the behavioral therapy application of the science. But autism itself has been around for a very long time. When we transitioned from the DSM-4 to the DSM-5, that's when autism really expanded to the spectrum. So previously, there was an umbrella that had things like Asperger's, if you've ever heard that before, or PDD-NOS, where you could get diagnosed with those individually. But now it's all under that autism spectrum, and then that's when they use those levels of a 1, 2, or 3.
So have the numbers increased over the years, or do you think it's that they've been able to diagnose it a little better over the years, or maybe it's both.
Yeah, maybe it's both, but certainly more awareness. And so we are getting really, really good at catching maybe some of those milder symptoms where a lot of those folks, like when you and I were growing up, would not have received the diagnosis because we just weren't as good at detecting, as well as just access to things like psychological evaluations and just more awareness about what the condition is.
Well, how early can it be diagnosed?
Typically about 18 months.
Really? And what kind of things would they be doing at 18 months that would make you wonder if they need to be
exactly. Sometimes
evaluated?
Yes, ma'am. Sometimes symptoms can be seen as early as 6 months, but typically we see some kind of developmental trajectory that is slightly delayed. So once you start to see those delays in the milestones, that's when typically your pediatrician or your family doctor will start to monitor those things. And so oftentimes we see no eye contact or they don't respond to their name, and so that's when we start to rule things out like hearing loss. And so we want to make sure that we do all of those things to make sure that it's not something like a deaf or hard of hearing. And so, not responding to their names. And oftentimes it's that repetitive behavior that you'll see. And so sometimes, like I said, the rocking or the clapping or spinning or humming, those kinds of things are typically present early on.
So are there things like you were talking about like the waving of the hands kind of thing. Is that something that they could even just outgrow? I mean, or is it something that...
Sometimes, sometimes. Oftentimes it is maybe transitioned to something different. And so oftentimes we have children that have hyper-focused special interests. And so I've had a few patients or children who have been really, really interested in Legos or really interested in the Titanic, and they know everything about the Titanic. And so oftentimes, we can grow out or shift from doing things like hand flapping or clapping, but oftentimes you see those repetitive or restricted behaviors in other ways.
Oh, and that makes sense. So why did UNIFI choose to open a location in Evansville? I know you said the headquarters were in Indianapolis.
Yes. So we're familiar with Evansville, myself and our 4 co-founders total. We have practiced in Evansville previously. We love this community. Everyone is so warm and welcoming. And one of our co-founders, Jerron Ferris, is from here. And so just bringing a service like this to this community, opening this building, we've had lots of really great feedback from the community just about a center like ours just doesn't exist here. And so we are really looking forward to being part of this community and contributing in other ways as well. So
how would you say your approach toward autism maybe is different from maybe other places in Evansville?
Sure. Yeah, so like I was mentioning earlier, we really look at the whole child. And so our clinical model is actually grounded in clinical integration, or looking at that whole child. And so we work with other disciplines or other specialists. And so we really integrate that care to where there's lots of communication and care coordination. And so we work with a child's pediatrician, for example. We work with our SLPs or OTs or PTs to make sure that all of the goals are basically in sync. And so although we have different practices and different disciplines, whatever the family is looking for, right? And so we look at things like functional communication. And so whether a speech pathologist might be working on oral movement, we can help decipher like what those targets should be. What should we work on first? What does the child like to interact with, or what do they need? What are their wants and needs? And so we work together collaboratively in that way to make sure that all of our goals are on the same page, because we know that that leads to best outcomes for the child.
What would you say are the biggest misconceptions about autism?
Oftentimes we hear they don't want to be around other people, or they like to play by themselves, which is true. They do, oftentimes like to play alone, but they also love social interaction. And so oftentimes we have to teach social cues. We have to teach how to approach individuals. We have to teach how to play with others, but they enjoy it just like any other child.
So is your service something that a parent contacts you, or are they referred, or is it both? I mean,
both. Yeah, absolutely. So families can reach out, of course, and we've since opened in Evansville, we've had a lot of folks just come in and want to tour and check out the building, which absolutely can happen. But the majority of the time, it requires a referral from the pediatrician to get an assessment. And so once the referral is sent over to UNIFI, then we will contact the family, tell a little bit about ourselves, and then if they're interested in moving forward with behavioral therapy, then we'll schedule an initial assessment, and that assessment determines kind of how much treatment, how frequently they're getting that, and then we work with the family to develop goals. And then most of the time, it is covered by insurance, and so it's typically a 6-month authorization where every 6 months we're reevaluating those goals.
So if somebody wants more information about UNIFI, what's the best way to do that?
Yeah, you can check out our website at www.unifiautismcare.com. And then on that, there are fax numbers, phone numbers, emails that you can reach out and contact us. There are several ways to get into touch.
Fax, what's that? I'm just kidding.
Right.
Thank you so much.
Yeah, thank you.